The CER Collaborative is a partnership among the Academy of Managed Care Pharmacy, AMCP, International Society for Pharmacoeconomics and Outcomes Research, ISPOR, and the National Pharmaceutical Council, NPC. It was designed to help identify the optimal ways to assess evidence and to inform decision-making. So this came about really as people were talking about that there's more evidence that was needed. There's more evidence that's needed about what works best for individual patients and how those treatments compare to other treatment alternatives. Researchers are generating even more observational studies, but in formulary decision-making we found that only about 1 in 3 plans were consistently using observational research, and most didn't have a process to assess the quality of these studies. So the CER Collaborative came together to try to help identify good research practices to increase the uniformity, transparency, and clarity of how observational studies can help inform formulary decision-making. The CER Collaborative, AMCP, ISPOR, and NPC, as well as their members, have put together tools to help formulary decision makers assess the evidence. So the first step of this is to assess whether a study is good or perhaps not as well conducted as they would want. So that assesses 4 individual types of studies: prospective studies, retrospective observational studies, modeling, and indirect treatment comparisons. And it allows the user to walk through in a very step-by-step manner whether the study is relevant and whether it's credible for their decision. And it allows the user to compare, contrast with their colleagues at other organizations, as well as to assess whether that information should be used in their decision-making. So that was the first step. The second step is, how does that individual study fit in with the body of evidence? So for instance, you may have 2 randomized controlled trials and 3 observational studies and a modeling study that all form your basis for making a formulary decision. What happens currently today is many will just use only 2 of the studies, the 2 randomized controlled studies, when there's additional information about what works best for real patients in real care settings from the other types of studies. So we've created another framework and adapted it for formulary decision making to combine randomized controlled trials as well as non-randomized controlled information to assess both how much benefit can you get from this treatment and how certain are you of those results. So the first part really helps you assess the individual studies, and the second part helps you combine those studies together. The third activity that the collaborative is working on is providing the training and the tools to help end users really understand the nuances of assessing the individual studies. This allows the end user to go and do this at their desk, in-person training, and also we're working towards a certification process that allows an end user who may not have had any training during their clinical degree to increase their confidence in their ability to use these new types of studies.